Good morning, everyone. I'm Kathleen Dowler, Director of Community Health for Dignity Health East Valley. Welcome to our second nonprofit town hall. We appreciate your participation and know that you will find the information from today's town hall very informative, the same as the first, and we do plan on continuing to have a series of town halls in the future as well. As a reminder, we will have everyone on mute unless presenting, and time has been allotted at the end of all the presentations for question and answer session. So please do use the chat format to enter in your questions and your comments, and we will keep track of those. Sarah Watts, the VP of Workforce and Community Partnership with the Town of Gilbert, is really the person who is navigating our Zoom call today, and she will be reviewing the comments and questions that you have to make sure that we use those when we do get to that point in time. I again would like to thank the Town of Gilbert as well as Gilbert Mesa Chamber for helping to lead this important effort to organize the nonprofit town halls. It's important that we get together and talk about the challenges that are occurring, and also to be able to have the support that's needed. So thank you for that support that you are providing. The purpose of today's town hall, our agenda again focuses on concerns that have been brought up either through the initial survey that we provided or through the previous town hall session. And as a result of that, we have key areas of focus for today and have speakers to really help address that as well. So we're very excited about that. And the key areas for today's purpose include school needs, homeless initiative, and funding updates for everyone. I would like to introduce Mike Thompson, the Superintendent of Higley Unified School District. And Mike will be discussing current challenges, support resources that are available, and current plan for opening in the fall. So again, Mike Thomason from the Superintendent of Higley Unified School District. Okay, Mike, are you ready?
I'm ready.
Awesome, thank you so much.
So good morning, everybody. Hope everyone is being safe and staying well. So currently, I think the one thing that most school districts need across the state of Arizona is information. Right now, we are stuck in limbo on knowing how to proceed, how to move forward with our fall openings until we have information, not just for fall openings, but for graduation services, for childcare services, our summer programs, all that. We need to know from the government and the CDC what options we have available to us, how many people we can have within a setting so we can move forward with our plans. I'm sure just as the other superintendents, we've all put together numerous different plans depending on CDC and Governor Ducey's guidance from Arizona on whether we can have 10 people gather, 50 people gather, 100 people gather, up to 5,000. We have the plans. We just need to know which direction to go. And so one of the main things that school districts and schools across Arizona need is just the information. How are we going to proceed in the fall? How are we going to proceed this summer? What's happening with graduation plans? I think we all have plans, but we don't have the information on how to move forward should things change. And we need advance notice. You can't tell us on Monday that you're opening it up for 500 people to get together on Friday, because that is just too short of notice. We can't move professionally and do what's right for our kids in our community without some good notice. And so number one, first and foremost, I think that's what we need. We do have plans. We have plans. Should we open with half capacity? We have plans. Should we open online in the fall? So I think we're ready to go with whatever direction we need. But at this time, we just need to know some direction from the CDC and from the state on where we're going. I think if we wait till mid-June, early July, it's going to be too late. So I think the sooner the better. Even if we have an idea of which direction we're going, it's going to help us out. So that is what I think the school districts need. On the short-term front, I think we're delivering meals. We're delivering about 6,000 meals a day to families and community members that come by our locations to pick those up. We're open from 7 a.m. to 6 p.m. at 7 different sites within our community to pick up meals. And what we do need for that as the summer heats up is we are currently renting a refrigerator truck to deliver meals to the different sites at a cost of $750 a week. And so that is one thing that the Higley Unified School District needs. Other than that, we're doing pretty well. Our community has stepped up. Our vendors have stepped up. We have tents, we have coolers, we have EVAP machines to help our individuals that are outside delivering those meals. But at this time, I think the only thing we need as far as food service goes and for our community is a refrigerated truck to help deliver the meals to different sites. Other than that, I think the Higley Unified School District is doing pretty well. We have our virtual graduation plan, and that's what we're moving forward with. I know it's very difficult to everyone happy, and everyone is different in a different place on the spectrum as far as their comfort level with COVID-19. We have everywhere from people that want to stay sheltered and just have things delivered to them to individuals that believe we should open up. And so we're trying to follow the recommendations of the state and the CDC and move forward the best we can with that. But we understand that we need to respect where everyone's at and understand that their individual situations can be very different from someone else's. And so just respecting where everybody's at and their comfort level with the COVID-19 is very important to our community and our district.
Thank you so much for that. Are there any specific, you stated a couple of challenges, one being the, not being sure when you will be opening in fall, to what degree, and what kind of plan to use. Is there, and then you talked about some of the resources for the meals, for example, the virtual education and the virtual graduation, which is really nice. Thank you so much for that. Is there a particular challenge that the nonprofit community can help you with?
I think we're doing pretty well at this time. I think the biggest thing that we're incurring cost on is the refrigerated truck. Other than that, I think the nonprofit community has been phenomenal. I mean, you could help get the word out. If anybody needs meals, anybody needs help with food services, that I think all of our school districts are able to care for that and to take care of them. Different locations, different times, but I believe getting that information out to anybody who might need it would be beneficial.
Great. Thank you so very much. We appreciate your information today and your time. Next, we have Andi Farlis, Superintendent of Mesa Public Schools, to present her challenges, available resources, and her plan for the fall as well. So, Andi, are you ready to go?
I'm ready to go. Good morning.
Thank you.
Thank you for the invitation to be here. I'm currently the Deputy Superintendent of Mesa Public Schools, and July 1st, I'll step into a new role, but for this year, I'll be sharing the information through our Deputy Superintendent lens. I'm ready.
Okay, go ahead. Thank you.
So you had asked that we speak about continuity of learning and what that is looking like in Mesa Public Schools. We are spending a lot of time thinking about how are we going to mitigate the learning loss that has happened. Our kids have not been in school since March 6th. They were on spring break when the governor closed schools. So when we think about the continuity of learning and learning loss and what does that look like, what do schools need in that world, we really need to be sure that we're taking good care of our employees, of our teachers. We are doing what's called a pulse survey with our staff. How are they navigating this world of school closure? What are the needs that they have? Many of them are feeling incredibly disconnected from their students. They're feeling what we have coined the term that we've been doing a lot of research on compassion fatigue. Very worried about their children when they haven't been able to connect with them. So we have spent our time and energy making sure that our students have a daily check-in with a caring adult. And we're hoping that that's going to help mitigate some of the learning loss just by staying connected to them. We've not been 100% successful in all schools and all grade levels, but certainly that is our top priority, is to stay connected to our kids. as we think about what the school year will look like when we open, we know that we're going to have to put our energy into assessing our kids, or what we would call screening our students, to figure out where they are on the academic continuum, so that we know how to focus our resources and how to focus our people to ensure that we are closing up some of those skill gaps, specifically in literacy and mathematics. Think about what do we need in terms of the nonprofit world. Would love to be able to talk about how do we harness the talents of our volunteers in the community to be able to come in and to support some of the learning loss that is happening with our students as soon as we have identified what that looks like. Oftentimes it is, we also have a huge need among our employees, are feeling very sad and lonely. Stories of our staff members who have, loved ones have passed away and they're not able to connect to them, and they're living in a very lonely environment. So how do we think about employ some of our nonprofit organizations and groups to be able to say, how do we support not just students, but how do we also support our employees that are living in very difficult and different times? I know that we have a short amount of time, so I'm going down my list here. Thinking about, I really echo what Mike shared from Higley. We absolutely need direction from our state. Right now, many of our school districts are navigating this world of school closure with limited information that is constantly changing. And we know that a constantly changing world is what we're up against right now. So we understand that, but we really need to be able to, when we open, we understand that Superintendent Hoffman has assembled a task force. They're supposed to have some guidance out by May 30th. And I continue to ask for, please make sure that this is a statewide plan, not a district by district plan. Make the framework flexible enough that whether you're a teeny tiny school district in rural Arizona or a very large urban school district, that we can connect our resources. And the other is, how do we, as large districts, how do we support others? I think that's a moral obligation that we have.
Awesome. Thank you so very much.
Sure. I think that was all over the gamut, but
yeah, no, it's very
Monday morning head is.
Yeah, I think, we have great respect for the school districts and how you are working through so many challenges at this time. You mentioned more than a couple of times, and I believe Mike alluded to it as well, the need to help with the teachers, their resiliency. And so our next town hall actually will be talking about mental health resources and resiliency for nonprofit staff and volunteers, but it will benefit the school district as well. So
I appreciate that. Thank you very much.
Yes. So thank you for the information again, very informative. And now we're going to move to Shane McCord, Superintendent of the Gilbert Public School District, again to share challenges, what type of support is being provided in the plan for the fall. Shane?
Good morning, everyone. Thank you for allowing me to chat this morning. I really just want to echo and reiterate the things that Mike and Andi said as it relates to some guidance from the state. We have been in great need of that because a lot of decisions need to be made, and we have plans A through Z available, but we don't know which one to enact just yet. And I completely understand where the state's coming from because they're also teetering on what restrictions will be in place at what time. And so, of course, if the governor comes out and gives us a little bit more direction, that would be extremely helpful to all of us. In Gilbert schools, we are taking care of people as much as possible. The adults, the students, and those in the community. We're serving about 6,500 to 7,000 meals a day from 8 locations, and from 8 o'clock in the morning till 10:30 in the morning. And they're picking up both breakfast and lunch. And all of our social workers, as well as our counselors, are reaching out to students on a daily or weekly basis, depending on the need, to touch base with them, especially those that are in specific need. We have made sure that our teachers have all the resources they need for remote learning, and they've done a tremendous job. But again, to reiterate what Andi and Mike have said, the novelty of remote learning is starting to wear off or has wore off. And they are desperately missing their students, their friends. This is a people business, and so they get most of their energy from each other. And that's been the biggest strain, I think, or from what I've noticed just from my own perspective of what they're missing. And looking into the summer, we are going to continue to reach out to all of our students and staff that may be offline at the end of May, but continue to reach out to them to make sure that their needs are fulfilled in any way possible. We're also we have a plan in place to be able to reintegrate back into the school system, transitioning back in, and what that will look like. Like Mike said, our plans for the fall go from no changes since before COVID-19 to drastic changes, totally online, and we've got a lot of different variations in between. Those aren't plans right now. Those are just thoughts, ideas, and sketches on a piece of paper. As we move closer and as we hear more from the state, we will definitely chisel those down and incorporate those from our school community as well as our parents to be able to have a little input and understand the process that we're going through. I think every school district in the state was hit with this, and I think a lot of people expected it just to maybe last for a couple weeks, and then we're going to go back and hit it. And I think every school district has done their very best to make sure the students are taken care of. Everybody does things a little bit different, but we all learn from each other and glean a lot of great ideas from each other. And so our seniors, as we speak, are going through virtual graduation. We're filming that, and we're up to our third or fourth school today, and hopefully we'll be done by the end of the week, and then we'll broadcast that online May 21st. And so we don't have necessarily any plans for any face-to-face graduation. A lot of our parents are wanting that, but we also, as school districts you'll hear us say in a lot of letters, our main goal is to keep your children safe, and that's exactly what we're trying to do. But if some things are changed, then maybe we'll have celebrations or look at a way to get kids together because they really want to say goodbye to each other in the most appropriate.
Yeah. Great.
At any rate, that's Gilbert Public Schools in a nutshell. So we appreciate you letting us talk.
Thank you so much, Shane. There's certainly a lot of consistencies in regards to the challenges that the school districts are facing. And I think everyone can appreciate the reaching out to the students and caring about the teachers who care for the students and how to take care of them as well. So appreciate that. And I think one of the questions that I will have later is how are the school districts reaching out to the parents during this unsteady time and preparing them for that loss and learning component and what they can expect as well. And I'm sure that is across the board. So I look forward to hearing that later. So we have our next speaker is Rachel Milne, the Assistant Director for Maricopa County Housing and Community Development. Rachel has been leading an innovative and a collaborative model to respond to the COVID-19 among the homeless population. Her leadership has brought together the hospital systems, including Dignity Health, municipalities, and nonprofit partners for the best practice model. Really, Rachel will be covering the established approach that is being used to address the homeless population during COVID-19, including those that are at risk for COVID-19. And she'll also be sharing some important resources. So Rachel, are you ready?
I'm ready. Thank you so much, Kathleen. Can you hear me?
Thank you.
All right. Thanks for having me today. I did want to talk about Maricopa County's plan for people experiencing homelessness throughout the region. Homelessness, as everyone knows, is a regional problem with regional solutions, and this pandemic really threw a wrench into a lot of things that the community was doing. But Maricopa County decided several months ago to focus on two main goals: to make sure we had a system in place once we knew we had COVID positive people experiencing homelessness, and to protect as much as possible the most vulnerable in our homelessness community, so those over 65 or those with other health conditions. So the first approach that we really focused on was to make sure we had a system in place for folks experiencing homelessness who we did know to be COVID positive or we did suspect to be COVID positive. And really the community already has in place a federally qualified healthcare center, Circle the City, which is the healthcare for the homeless provider for the entire region. They have mobile units throughout the county, but they also have a center right in downtown Phoenix, which they converted to isolation units for COVID positive individuals. So they have been a fantastic partner with the county as well as all of the cities and shelters throughout the region in ensuring that we had a safe place once we started to get COVID positive folks experiencing homelessness. So they've completely converted their downtown Phoenix center into isolation units, a total of 10 isolation units for people that we are known to be positive. And then they have an additional, they have an entire tent situation in their parking lot for up to 48 people that are awaiting test results or suspected to be COVID positive. So what we're calling our people under investigation or PUI tents. And so they immediately put the system in place, and maybe luckily we learned from other communities who had gone through, who had sort of experienced coronavirus pandemic in their homeless populations prior to really the Maricopa County area. And so we learned from other communities such as King County specifically and Los Angeles County to really mimic some of the things that they put in place. So not only do we have Circle the City's isolation units in their downtown facility and their tent units for people waiting for tests, but Maricopa County also rented an entire hotel in downtown Phoenix for overflow. For once we know that those 10 isolation beds will be utilized in Circle the City, we have an entire hotel that is staffed by a nonprofit partner, Community Bridges, to site manage. We have 24/7 security at that hotel, and then we also have Circle the City staff that are doing medical rounds. We've got nurses and CNAs on staff that are coming to that hotel to check on their patients as well. So that system has been put in place and luckily has not been utilized nearly to the extent that some of our other counties across the country have seen, which has been a real blessing. But it is currently in use, and we've also had a great partnership with Sonora Quest, who initially donated 300 tests to Circle the City, and then the county actually just purchased an additional 500 more so that we really don't have a problem with testing those most vulnerable in the community and those that are symptomatic. Mm-hmm. The second, really, the thing that the county really also focused on from the very beginning was making sure we were isolating those most vulnerable that were experiencing homelessness. We have a lot of people age 65 and up in the homelessness community and a lot of people with health conditions. So in order to get them out of a large congregate setting, the county, along with several other partners, put into place a few different approaches to try and keep them as safe as possible. One of the things we did is we partnered with a New Leaf. They had a vacant facility in the East Valley, so that was actually set up that could be easily transformed into a shelter for those most vulnerable. So we have been renting that from a New Leaf since the beginning of April. We have a shelter provider, Community Bridges Incorporated, that's actually staffing that shelter. And then we've been working with shelters across the valley to find out who are their most vulnerable within their shelter system, get them a test, and then move them to this shelter that we rented from a New Leaf, which is in Scottsdale. So making sure that everyone who's moving there has a negative test first and foremost, and making sure we're moving the people that really are at the highest risk for getting COVID-19 in a congregate setting. And so that facility has capacity for 48 people. We're currently at about 30. It's taking a little bit of time making sure we're testing everyone before we move them over there. And then our partners, Circle the City and Community Bridges Incorporated, have been moving folks to that facility. Another approach we've used, we are leasing 25 rooms at a hotel in the East Valley, and that the county has leased all of the rooms, is providing 24/7 security, but we've allowed the cities of Mesa, Tempe, and Chandler to utilize those rooms for their most vulnerable folks, whether they are from a shelter situation, a street situation. It was up to those cities to determine who would go into those rooms and to make sure that they were continuing to be case managed and checked on daily. The city of Phoenix also has really been putting a lot of funding together via its CARES Act to make sure it's protecting its most vulnerable and going to hopefully house everyone that we can in a permanent situation once we're able to breathe again after this pandemic. But the city of Phoenix this Wednesday is opening a hotel for the most vulnerable, specifically from the downtown Phoenix Human Service Campus, people staying at CAS, the largest shelter in Arizona. They will be moving 100 people from CAS into a 100-room hotel. And that will happen. It will begin to happen this Wednesday, and it will, they're testing every single person that's moving over to that hotel as well. So it will take a little while to get going, but that way, the most vulnerable have a door. They can isolate. They're not in a large congregate setting any longer. And then the last thing that I wanted to mention that the county has done, I don't know if a lot of you have been to the Human Services Campus downtown Phoenix, but they can shelter around 400 or so people a night within the walls of the Human Service Campus. And then there are just hundreds and hundreds of people outside those walls as well. Camping, not social distancing. Really, these tents were right on top of one another. So the county went ahead and opened up 3 of its parking lots in downtown Phoenix and painted 12 by 12 squares and invited folks who maybe wanted a little bit more of their own space to come into those areas and set up their tent in those areas to have a little bit more space. We also added some restroom facilities, hand washing stations, and a hydration station for those folks. So in total, we have about 215 parking lot spaces. People have been really interested in moving over to those spaces and utilizing the restrooms and the hand washing stations. We're allowing people to take their pets onto those lots as well. We've had some really great stories of people reaching out and wanting some case management, wanting their pets to get their shots so they could be able to enter shelter at some point. So so far so good on that. We're calling it our safe outdoor space in downtown Phoenix. And the third thing that I really wanted to mention is our hotline system, our transportation system that we've put in place, both for shelters throughout the region as well as for hospital discharges. The one thing we didn't want to have happen was for hospitals to discharge people experiencing homelessness when we know they have, if we know they have a positive test result, because they would be discharging to the street or possibly back into a congregate shelter situation. So we've created a 24-hour hotline, both for hospitals to be able to call as well as shelters. And the hotline can provide, we have multiple transportation providers, so we can transport someone from a hospital down to one of our isolation beds, either at Circle the City or one of our hotels that we have designated for COVID positive people. So we're discharging not to the street, not to shelter, but we're discharging right into an isolation bed so that person can stay safe with a door, have meals delivered to them for the entire time that they need to quarantine. So that's worked out really well. And then for shelters, it's similar. If a shelter anywhere across the region has someone who is symptomatic and needs a test, we can provide transportation downtown to Phoenix to one of the PUI beds at Circle the City. I mentioned we had 48 of those PUI beds in a tent situation at Circle the City, and we can test them right there and get their results. If they are positive, they can go straight into an isolation unit, and if they're negative, they can return to their shelter system or one of our vulnerable facilities. And that is really what Maricopa County has been working on these last 3 months or so, to make sure our systems are in place so that if and when we do have a surge within the homeless population, we are ready to go.
Thank you so much, Rachel. Extremely important population to pay attention to, in part because they are such high risk, and also because that ability for the virus to really spread. And I've been on weekly calls with Rachel and Maricopa County and other healthcare organizations, and the planning has been outstanding. And again, to me, this is a model to replicate elsewhere. And
Kathleen?
Yes.
We just have one question from a panelist right now for Rachel specifically,
Sure.
or from an attendee. Rachel, would you be willing to share your contact information?
Oh, absolutely. So my phone number is 602-372-1528. And my email address is Rachel, RACHEL, .Milne, MILNE, @maricopa.gov.
Perfect, thank you.
And Rachel, you have the hotline flyer, or that you're able to share as well?
Yes, shall I send that over to you, Kathleen?
If you could send it to Sarah, and we'll get it out to the group.
Perfect.
Excellent, thank you so much. And I think
No problem.
Rachel brought up a good point about there's two areas of focus for the transportation. One is from the hospitals to the facilities, circle the city, or the hotels where they're caring specifically for those that have tested positive. And then also for the shelters, if you have someone that you suspect, that they can also get them to where they can be tested and then appropriately monitored. So thank you very much, Rachel, for that.
Thank you.
Next we have Michelle Albanese from the city of Mesa to give an overview of financial opportunities related to the COVID-19 response.
Good morning.
Michelle, are you on and ready?
I am. Can everyone hear me, see me?
Yes, thank you so much.
Absolutely. Thank you for having me. I'm really excited to share what Mesa's been doing to address the COVID crisis. So I'm going to talk a little bit about the federal funding that we're receiving in our housing and community development area, as well as some other initiatives that the city is taking. So first and foremost, just as Rachel mentioned about Maricopa County, we are receiving some additional funding through the CARES Act for CDBG, as well as the ESG for Emergency Solutions Grant. And we just concluded a solicitation process for the ESG funding in the amount of $1,130,000. And so we will be getting another allocation of that same amount within 90 days, but that was the first allocation we received. And we are going to be funding 5 different activities with those funds. 2 activities of emergency shelter. One is a new leaf where they're going to be expanding by 20 additional beds, so that they can really practice that social distancing and have, the proper PPE and hand washing stations and all of that at their shelter, East Valley Men's Shelter. Mesa United Way will be funded to provide emergency shelter vouchers so that folks that are either identified as positive or just want to self-quarantine because they think they might have it, then they can go into a hotel with these vouchers. We'll be funding community bridges for a navigator to be out in the community and conduct outreach to those individuals who are homeless, try to get them in some type of shelter, or at least provide some PPE for them, and to make sure that they're not positive. Save the Family will be funded rapid rehousing funds through ESG, and so they will be providing housing opportunities for those individuals that are currently in shelter for families. And Save the Family will also be administering a homeless prevention program. So these are folks that are already housed and maybe due to loss of income or loss of job or being ill and not being able to work, that they can get up to 90 days of rent and utilities for helping with the COVID crisis. For CDBG, we'll be receiving approximately $2.3 million, and We have not yet determined exactly what we're going to be using those funds for. Right now, we have an additional $600,000 in unprogrammed CDBG funds that we're going to be allocating to a emergency rent and mortgage program. So we will be providing, similar to Save the Family, up to 90 days assistance to pay for either back rent, back mortgage, or to help with the next couple of months. But if I'm invited back for another town hall, I'll be able to share what we are doing with the CDBG COVID money. Just a few things that the city's doing as a holistic approach. So we received approximately $90 million from the Treasury. So we were one of the cities here that qualified for those funds. Funds have to be expended by December 31st. And so one of the first programs that the city is rolling out is a small business reemergence program. And it's a one-time grant to assist businesses, so for-profit businesses, with rent, mortgage, and utilities up to 90 days that were either closed or had limited service due to COVID. And the businesses cannot have received any other type of funding, including the paycheck prevention or the PPP paycheck program. I can't remember the name of it, or the disaster loan program. So they're currently taking applications until the 24th. And they have not set a dollar limit yet on how much each business can get, but I think they're waiting to see how many applications they're going to receive. Mesa's also collaborated with United Food Bank and started the Feeding Mesa program. You've probably seen on the news, the mayor out at the Mesa Convention Center working with United Food Bank Wednesdays 2 to 6 and Fridays 7 to 11. And so the amount of food and just the donations and everything has been unbelievable. The last one I wanted to mention is what they're calling Inspire Mesa. And it's a grassroots digital campaign that's really been developed to highlight positive ways that residents can connect with their neighbors during this isolation time. So there's different topics and different speakers, and individuals can watch that. It's aired. I'm not sure how often it's aired, but I think it's once a week. But there is information on our website, which they're calling Mesa Cares. So if anyone was interested in looking at what the city is doing, you could just Google City of Mesa, Mesa Cares program. And I think that's pretty much it.
Thank you so much. Again, very informative. We appreciate it very much.
Absolutely.
A good explanation of the different funding sources, what they're going towards, and what to expect. Thank you again for that.
Very welcome.
And I anticipate you'll have some questions. And now I want to introduce Melanie Dykstra from the town of Gilbert, and she's going to give an update on the Gilbert financial opportunities, some of which he had spoken about at the previous town hall, and also about our community-wide food drive.
All right, can everybody hear me? I'm going to leave my video off because I'm usually a little difficult to hear. As most everybody knew, Gilbert did receive the just over $568,000 in the CDBG CARES fund, and our applications were open over the last about 2 weeks. We closed last night. Right now, we've received about 12 applications in from a variety of entities. The requests are over $1 million, so we will have to make some choices as to how we allocate the funds. But we will begin evaluating those applications today and recommending the funding through the end of May here, with final recommendations are going to go and get approved by council, hopefully the first meeting in June, and then we'll get that started. So that's kind of our process. We have not heard of any additional allocations yet. Gilbert is not to the same size and level that Mesa is, where they did receive that additional funds. We may receive something through the state, but we have not received any information to date. In addition, there may be some other CDBG funds, but again, we have not received any notification of that information to date. So right now we'll be first just reviewing those applications that came in, kind of looking, and that's why it's always important to hear what the need is out there and where everybody's kind of sitting, to know what other municipalities are doing. It does impact, you know, how we can best make sure our funds are used to those who are most in need of organizations who may not be receiving funding through other sources. So that's something we're definitely paying attention to and want to make sure we're aware of so that we can provide ours to the most need that we have within our Gilbert community. So with that, one of the other things we are trying to do is we did hear somewhat of a need from our food banks and pantries that there was definitely some uptick in need from the community for the services. And so we wanted to also be supportive of that. So we're kicking off the community food drive. It's kind of a blitz opportunity coming up this weekend, May 15th through the 17th. We have 21 locations signed up to be drop-off and collection sites. They'll be operating from 7 a.m. to 5 p.m. each of those days. They'll have volunteers available for people to drive by and drop off food donations. And so we're encouraging our entire community of those who can participate and be engaged in providing the food needed to our banks and pantries that they participate. And everyone can find more information at gilz.gov/feeding families, and I'll put that in the chat as well. But we're hoping that that's a good turnout. Our community, those who can provide that support to others so that we refill kind of our banks and pantries so that that can also continue to come out into the community. So I think with that, those were my updates to date.
Thank you so much, Melanie. Appreciate that very much. And now we are going to open up to questions for the group.
I don't see any current questions popping up. Remember, you can post it or in the Q&A or in the chat if you have a question.
I did have one question myself, Sarah, that I alluded to earlier, and that is how are the schools reaching out to the parents during this time, both to help them to try and teach their children, but also in regards to the lost learning, what the parents can expect in regards to when school does return in the fall, or if it's even if it's delayed, how the parents can work through that.
Hi, this is Dr. Thomason, Higley Unified School District. I can answer those for our district. So beginning in the fall, we have opportunities for students to come in and do their regular beginning of the year pre-test to find out where they're at and what learning has occurred or what learning has not occurred over the long summer loss for our students. And we usually do a pre-test at the beginning of the year at different grade levels. And so we'll be continuing that and taking our data and information and moving forward from there. From that aspect too, there could be other things that are involved. We do have a 2-week fall break and a 2-week spring break. There are some discussions depending on what happens with Governor Ducey and the CDC recommendations on bringing special programs in during those breaks too for our students. And so we're taking a look at a lot of different things. The difficult part, Kathleen, is that we don't know what we're allowed to do and what we're not allowed to do. And so waiting for direction from the CDC and from Governor Ducey on how our future looks. I mean, we have lots of different options and opportunities, but waiting for some direction on how to go about putting those in place.
Thank you so much. Any other questions from the group or comments? Okay. Do you see anything coming through, Sarah?
Don't see any questions right now. This was great. Thank you so much from Jamie. Let's see. Melanie's posted another update for the group if everyone wants to reference the helper website. They have 186 needs posted right now, so that's a good opportunity to engage with nonprofits.
Excellent. Yeah, it'd be a good reminder for people to go on to the nonprofit Facebook group, as well as so that you can see those specific needs to help each other out and post your own needs as well.
Yeah, and just to note on that Facebook group, you don't have to have a moderator of that group post. You're welcome to post your own needs there anytime you'd like and engage with the community there as well.
Excellent.
Okay, I don't see any other questions right now.
Okay. If there's no other questions or comments, what about the speakers? Do any of the speakers have any last minute comment? Okay. All right. I'd like to thank everyone for being on the call today, our speakers for your time and your very important information that you shared with everyone. Our next town hall, we were going to be focusing on resiliency and mental health for our nonprofit employees and staff and volunteers. We're also going to be focusing on connecting with our seniors. And then we also are going to, at the next town hall or the one after that, we're going to focus on nonprofit fundraising. There are a lot of webinars that are occurring, and nearly every nonprofit is focusing on how to do virtual platforms. So we're going to begin talking a little bit about that either at the next town hall or the one after that. And so until that time, I thank all of you again for participating today, for your time, for the town of Gilbert, for the Gilbert and Mesa Chamber. Be safe, be healthy, and certainly stay connected. God bless you all.